Treasure Coast Connector, connecting residents and businesses of the Treasure Coast. And here's your host, Ellen Contreras.
Well, welcome to Treasure Coast Connector. I'm your host, Ellen Contreras. Happy to announce that Treasure Coast Printers is one of our sponsors. They're a one-stop shop for all your printing needs. I'm talking about business cards, brochures, flyers, signs, banners, promo items, and so much more. Their website, www.treasurecoastprinters.com. The phone number, 772-202-2721. Give them a call. Use the promo code if you want a deal, 10% off your entire order, TCC 2020. So Treasure Coast Connector is a show that puts a spotlight on local business owners because we want to hear their backstory, why they started their businesses, what makes their products and services so unique and special. Today, we're going to learn about a clinic located in Fort Pierce that is changing the way that healthcare is being delivered in a positive way for the physicians and their patients. Dr. Jessica McCain is the founder of Southern Comfort Health Direct Primary Care, and she is part of a growing movement that is making medicine personal again. So welcome back to the show.
Oh, thanks so much, Ellen.
Yeah, wonderful to have you here.
I appreciate it.
We have a lot to talk about. We're going to jump right in. I want to know what made you want to become a primary care physician and open up your practice?
I knew you were going to ask this question, so I've got like a part one and a part two.
Yes.
So we'll just say, how did I become a primary care physician first, and then why I became a DPC doctor?
Yes, second.
I'm just a driven person. I always take opportunity that presents itself. I can remember, everyone what's that moment you wanted to become a doctor? In fifth grade, when they were telling us about middle school, the orchestra teacher for Lincoln Park came and said, if you actually are in an interview for medical school and you've played the violin, you're going to get into school because you've got hand dexterity and you've got poise. So I was sold. I had to learn the violin then. And I think I always had that in my mind, that I'm always going to take every opportunity I have to better myself. And it's been a combination of teachers and mentors who have led me to my career, my calling as a family practice physician. Because they challenged me with advanced coursework. They fostered my skills and discipline. I played sports all through into college, and I majored in exercise science. I was well-rounded with a lot of volunteering. I volunteered with the Alzheimer's Resource Center and hospice. And while I was in school, I also worked. I worked as a resident assistant in the dormitory, as a teacher assistant for organic chemistry and immunology. So I always had a lot on my plate. And then I also was exposed to life. I lived abroad in Grenada for 2 years, in New York, in Miami. So I've been experienced with a lot of different cultures. And I bring this up because, I'm well-rounded, and all my experiences have led me to be a little bit more relatable. And I think that's what makes me able to be a good family practice physician. You don't really decide what kind of doctor you're going to be until actually after medical school, when you've gone through all your rotations. And it just happens that when you like every rotation, you tend to gravitate towards family medicine because primary care is the front lines of basic needs.
Yeah, you touch everything.
Exactly. We do the whole body, the whole person, but we also care for their families and for the entire breadth of life. So I just like the idea of something that I can be, always continuing to learn and just always finding community resources and helping people for every little thing. I guess the second part was the
DPC.
Why am I a DPC physician? And the reason why I opened up a clinic in Fort Pierce is because I just don't fit in a box. And I think that's pretty much it. When I was working at my regular clinic after a couple of years, I found that I was just disappointed that I had been groomed all these years of education to be a cog in what is a dysfunctional healthcare system. And I didn't feel like I had any power to make that change, whether it was for my patient's benefit or for my own personal life. So then I just took it upon myself to say there's got to be a different way to practice medicine. And I learned about alternatives. I found additional mentors, and I adopted a model that creates a care without the burden of the restrictions imposed by insurance and government regulations.
Very
so
nice.
Previously, what I was previously in was called a fee-for-service model. And I found that it was so inefficient. I was saying sorry to every patient on a regular basis throughout the day. And I disagreed with the policies that we had to see a lot of patients.
Not enough time.
Not enough time. And in a shabby manner, just because there's so much administrative overhead to deal with the paperwork associated with dealing with insurance companies. So now that I've created my direct primary care, I'm back to caring for patients the way that I want to. I set my own rules the way that I would want to be cared for as a patient. I have a better business approach, and I'm creating a place for my community and just a lot of different opportunity again to see it any way I want it to go.
Well, that is wonderful. So now a lot of people that are listening and watching are hearing DPC, direct primary care, and before meeting you, had no idea what that meant. So let's just jump into that aspect. What is a direct primary care practice all about?
Yeah, so it's very grassroots. We do have to take the time to explain what it is. It's medicine practice the old way.
Okay.
It was a term coined about 10 years ago when there was a group of physicians that decided that instead of dealing with the insurance companies, they're going to contract their medical service directly with the patient, because they recognized in the current system that when you have the middlemen, when you have the red tape, when you have special interest groups, it interferes with that patient-physician relationship, and it turns into a poorly run factory style of medicine where you've got crowded waiting rooms. You get 7 minutes of FaceTime with a provider that changes every once in a while, and you have no choice of who you're seeing. It becomes paperwork priority over patient care. So with the DPC, the direct primary care, it just says, let's bring it down to more common sense business approach. Just have a flat rate monthly membership due. Be very transparent about any of your prices, but include a lot of value in that monthly membership. So we don't process insurance for paperwork for reimbursement, and we don't need the insurance's approvals to practice care that I see fit. And I'm not, checking boxes, and they're not dictating how I need to document my notes. I document what's clinically significant for actually the care. And so what we've done is by cutting out a lot of that extraneous work, we cut down our business expense by more than 50%. So the result is I don't have to actually see 3,000 different patients a year. My panel is less than 600, which means more personal care for each individual patient, and a lot less headache for myself and my staff, because we're just not dealing with these big companies and big systems.
Yeah, and especially not dealing with the insurance aspect.
Exactly.
So, okay, so now explain the process when someone calls you up to inquire about you being their family medicine physician. What happens next?
Well, so a lot of people may be familiar with the term concierge care, and it's very similar to that, but we like to say, but without the sticker shock. We don't process insurance at all. Concierge doctors may still be processing insurance. But basically, the value that you get is you get appointments the same day or the next day. I'll do home visits if it's necessary, or we can meet after hours, video chats, phone calls, text messages, emails. There's no additional co-pays every time you reach out to me. Visits are not rushed. Most of my visits are at least an hour long. And then I actually have more time to, continue my own education, find resources, community resources that could benefit. And basically what DPC is doing, it's a nationally growing movement, because we realize that patients aren't going to the doctors because it's inconvenient, it's costly, and impersonal. And it's so complex. The recent Medicare guidelines came out, and they were 2,700 pages long, but I kind of explained my business model in a trifold brochure. So that's kind of the basic of it. And we do want people to have insurance. I want to kind of clarify that, because there's certain things that obviously a primary care physician can't handle. But there's other ways around to find insurance models or a catastrophic wraparound plan. And still use our services. So I think your original question was, tell me a little bit more about the membership and the discounts.
Yeah.
So we've actually pre-negotiated rates also with different laboratories, and also we get associations because of the DPC network we have for pharmaceuticals. And then we're also making a database of local specialists who offer cash rates to patients. And these are sometimes uninsured patients. Maybe these are patients who have health sharing plans where they pay up front and then they do the paperwork to get reimbursed later. But just to give you an example, so a laboratory panel that I call like my basics, which is a CBC looking for bone marrow, a CMP, which is a metabolic panel looking at kidney, liver, electrolytes, checking for cholesterol, looking at thyroid, and an A1C for diabetes. If that claim gets submitted to an insurance company, it's probably for about $270. And healthcare professionals probably say, yeah, that's probably accurate. It may even be a little bit more than that. I can do the same panel if you want to pay cash up front for $17.
Can you say that again?
$17.
Wow.
You get all those labs. And most of my labs are $3 and $4. I think our most expensive lab is a vitamin D for $15.
Wow.
So that's one example of how we have added value to our members. The other is prescriptions. So we actually have like a pharmacy in
You
our...
have a dispensary.
Exactly. We have a dispensary legally is the right term for it because what we do is we buy medications at wholesale 80 to 90% off and we sell them to the patients at our value. So for example, I just picked one, compared it to Walgreens online pharmacy Celebrex, 200 milligrams, 100 tabs, pharmacy price $218.
I know. My mom had rheumatoid arthritis, so wow.
Yeah.
Yes, okay.
GoodRx discount coupon, which I always encourage patients to say, what would it cost if I didn't use my insurance? Because surprisingly, sometimes it's cheaper not to use your insurance. GoodRx has the same amount for $79, and if you buy it from Southern Comfort, $10. So that is the markup we're talking about by adding all these different middlemen.
Oh
and what's really neat with our electronic medical record system is at the end of the month, we'll actually tell you how much you saved by using our dispensary compared to GoodRx. And it doesn't have to be prescription medicines either. Walleton, right now, on sale, $639 when you're going through that Publix aisle.
Yeah.
5 tablets for $639. I can get you 365 tablets for $12. So really huge markup. But some things are actually also included in our membership. So if it's EKGs, ear lavages, removal of skin tags, even suturing, things that are kind of urgent, we're not going to charge you for those things. If it's something like a knee injection, the only thing I'm going to charge you is the cost of my steroids that I'm going to be putting in your knee. So $15 for a knee injection.
My husband has had that a couple of times in the past, but I have to say that when people that are listening to this, I want them to understand that they can call you and have a meeting with you, and you have all of these resources. You're not in the insurance world, but yet in the front office, the front space of your office, you have all of these resources so that people can actually get the different types of insurance coverages they need so that DPC is the right fit for them.
Yeah, so in our front room we have a resource center which we're pretty proud of. It's growing, and it's one of those things that just makes it fun. So when I'm out and about and I see a flyer for any type of support group, there's a CPAP clinic that Perkins offers. That's going to be helpful for some of my patients. I'll grab those flyers and we'll just post them up in our resource room. And so when someone has a need, I can just run out, grab them the brochure, hand it to them, say, you should check this out. So again, we are trying to connect people with resources because we are seeing the whole person, and we're responsible a little bit for their financial health, and we have to be mindful of the healthcare system and what that means for some people.
Oh, absolutely. So what we're going to do is we are going to take a break because we do need to do these commercial things. The commercial things are good. You're going to want to listen to them, but stay tuned because Dr. Jessica McCain and I have so much more to talk about when we return. We'll be right back.
Take a new direction with your pest control needs. Call Compass Pest Control. Hi, I'm Chris Hudman, co-owner of Compass Pest Control. We're not your ordinary pest control company. We have over 60 years of local experience. We know service after the sale is the most important part of our business. Call us at 925-1740. That's 772-925-1740, or on the web at compasspests.com. That's compass, PESTS.com.
It's time to call Easy Brew Coffee and Bottled Water Service and learn just how much you can save and how convenient it is to have your coffee and bottled water delivered right to your home or office. In addition to water coolers, Easy Brew offers individual bottles of water in 8 or 16-ounce bottles. No more lugging it home or dragging it into the office. Serving the Treasure Coast for over 2 decades, 2 letters, 1 simple name. Easy for Easy Brew. Visit e-zbrew.com or call 800-792-3285. Easy Brew.
Blue Dolphin Pools strives to provide quality service with a well-trained staff in the field and in the office. They want you to know that your pool or spa investment means much more to them than just another account. They believe you have entrusted them with your investment, and they'll do their best to see that it stays in top condition. Blue Dolphin Pool has been in business over 35 years, setting them apart from the competition. Residential or commercial, Blue Dolphin will keep you in the swim. 567-5853.
ITEX, or International Trade Exchange, is the largest barter company in the world with over 25,000 members offering goods and services. We're a marketing company that brings you new business in the way of trade, with over 200 local members enjoying the benefits of ITEX, like lawyers, doctors, plumbers, media, printing, and more.
Hi, this is Liz Bowler. Contact me and find out why barter through ITEX has been smarter for over 30 years. 772-532-1881. Visit itex.com.
Coast Connector. I'm your host, Ellen Contreras. Treasure Coast Printers is one of our sponsors. Dr. Jessica McCain and I were talking about her amazing direct primary care clinic, Southern Comfort Health. So, Dr. McCain, let's go dive back into this conversation, because it's this wonderful quality of care. You can spend more time with your patients, but you're not dealing with insurance. So I want people to understand that when they call for that very first visit to learn about your practice, you and your practice, you're going to sit down with them, learn about them and their history, and then make sure when they walk out, they have a full understanding of all the options. You don't sell insurance, but you have all the resources there so that they can make sure that if they have to make changes, that they're going to get the right coverages in order to take advantage of your amazing plans.
Right. So we call those meet and greet visits. And I like doing meet and greets with patients so that way they know what they're getting themselves into, because it's a membership. And to be honest, I invest a lot of time and effort into getting to know each patient and, collecting all the records and doing really great summaries. When a patient leaves after the first visit, they'll get a summary of all of the medical care that they've had in just a nice, complete document. So one of the patients I've had come in had seen 13 different specialists, and that was her goal, just to kind of consolidate. Did she really need to go to all these people? So we did a lot of work to get all those records and just put them into a nice 3-page document of what's been going on with her life. So meet and greets are really important because, again, it's just a mutual investment, and I want to make sure that my panel of patients, it's going to be limited to 550 or 600 patients. They're going to be with me for the long run, because I'm a family physician, and I'm seeing babies being born, and I'm saying goodbye to family members as well. And so that's what I, signed up for as a family doctor, is to be there for the long haul.
You know what else I like is the different ways that you will see your patients. You have they have a lot of accessibility to you, telemedicine. So I was thinking immediately of elderly patients and busy parents with a lot of children, or even 2 children or whatever, and it's strep throat or whatever, and they just don't want to get out there. So you'll deal with them.
Absolutely. And the truth is,
I love that.
We really don't need to see you every single time for everything. It's just, again, that healthcare system where we depended on the copay and you coming in just to tell you your labs are normal. That just really shouldn't happen. And so this situation is, if I get lab results in, I will send you an email copy of those, put a little email note about what these labs mean. Don't be alarmed by this little red note, not significant. Let's talk about it further, So
that's good, so that somebody can read their results and then call you. You'll go over it with them, and there's no additional
It's whatever
co-pays.
their preference is. If they want to come in and talk about the results, great. While we're there, hey, let's take a look at some of your skin tags and cut them off if we're concerned about them. So it's just it's a little bit more fluid of an appointment. We can set the agenda and move it very easily and take the time to break things down if we need to.
And then if they have specialists, you are part of the treatment team. So it's you communicating with the specialist
exactly.
too.
And it's really actually been kind of surprising. The specialists that I've already kind of connected with, they call me back. They're like, you're the first primary doctor in a really long time to tell me that you're going to be changing my medicines or that you're concerned about a patient. I'm going to take extra look. Thank you. So I love the fact that this is going to really bring back the camaraderie of physicians. It's not going to be primary versus specialist. Let's work together. And I've offered to patients, and I've actually done this a couple of times already. If I don't have an appointment already, I'll go with your specialist doctor, because I like to show my face and just, be a translator. Sometimes that's all we need is a translator, especially if you're in a hospital.
Yes, and that is very true. But another thing I want to touch on very quickly is the fact that this is a big benefit for the self-employed and the small business owner. So if you want to give me 30 seconds of...
Yeah, what, I was actually surprised when I went to the Chamber of Commerce. So many people came up to me afterwards. These are really well-educated people who said, I don't have a doctor, I don't have insurance. And that's actually kind of a scary statement to make. There's a big percentage of people who are employed, but maybe they don't have, work benefits. They're self-employed or they're contractors. maybe they're not eligible for Medicaid, but they can't really afford commercial insurance either. One thing that's happened as of January is that there's no longer a penalty for not having insurance, which really opens up a lot of opportunities. So that means that DPC Care can be your primary, and you can get other versions, not insurance, but like a health sharing plan or a catastrophic wraparound plan, which is really then your complete care coverage. So we will refer patients to agents that know a lot about DPC and that the other alternatives to insurance to make sure patients are covered if they go to the hospital or they see specialists. But even businesses who do offer their employees benefits, what nice respect that they could give is to say, I'm going to offer you a different option. If you want to go to DPC, you can choose. Or if you want to stay with our insurance, you can go that way as well. But actually, it is saving businesses a lot of money, and they can potentially cover the full cost of membership plus a health share plan with going to the DPC route.
So what we're going to do very quickly, I just want to say thank you to Treasure Coast Printers for sponsoring this episode. They are a one-stop shop for all of your printing needs: business cards, brochures, flyers, banners, signs, promo items. 772-202-2721, www.treasurecoastprinters.com. Don't forget that promo code TCC2020, 10% off your entire order. So before I ask my last question about the elephant in the room, tell everyone that's listening how they can contact you directly.
So our website is www.socohealthdpc.com, and our phone number is 772-252-0140.
Very good. And I always want to repeat that number one more time because I know there's people trying to write really fast.
Right. So it's 772-252-0140, Southern Comfort Health.
Very good. Okay. So now when we have a few minutes. I was just trying to get through that because we have an elephant in the room. When we first met, over a month ago, COVID-19 wasn't even on my radar. It was on yours, but it was not on mine. So what would you like to say about this?
It's a really interesting time right now. We were talking about a pandemic. By definition, that means the whole world is affected by this coronavirus. The last pandemic was 10 years ago with the H1N1 swine flu. And coronavirus is just a very, very different bug. And it's a little bit more virulent, meaning that you don't need as much bug or it can linger a little bit longer to cause more contagious infections. So, a lot has changed. Even after another decade, there's a lot more mobility with people in being socially connected, and we're all fighting this invisible enemy. And so even, state versus state, we're trying to just hold our own. So it's a little bit hard for us to help our neighbors. And it's a very confusing time. A lot of big decisions are being made and very, very rapidly with some limited information.
And it changes every day.
Exactly. And even healthcare professionals, trust that we are on, we're very connected and healthcare professionals are talking amongst each other with mixed opinions about what should be done. Excuse me. But I think it's definitely understood that this is a very challenging time. We are going to have the loss of a lot of beloved people, and businesses may fold. So I guess my lasting point I would like to make is this too shall pass.
Yes.
We will get to a point where hands can be shaken and we can find the benefit that future generations, the innovation and creativity solutions that are being made where, a $10,000 ventilator part is now being made on 3D printers for pennies, medical advancements and changes in protocol. And, it's been realized that the government restrictions that were previously there, the red tape, the inability to do telemedicine, which now everybody is doing, we are now realizing that sometimes it's just a little bit too much. And in order to provide quality care and with proper medical care, maybe we just need to take a step back and let doctors do their thing, which is why DPC has been successful for the past decade, because we've been doing telemedicine and we've been operating with that personal level of care and keeping in touch with our patients when times get scary.
Very nice. And of course, you are staying up on all the latest treatments and everything else because you are a research person, a continuous learner type. So that is wonderful. I'm just looking at my countdown clock. We have a little bit of time. So you can talk a little bit more about COVID, or if there is something else, I think we have 1 minute left, Thank you very much, Cindy. She keeps me in line. Thank goodness. Without her, I would run amok. So what else would you like to say about your practice? Now that we
let me just tell you
50 seconds.
Okay, quick examples of patients that we've seen at our DPC that, we've been open now for 2 months, and it's exactly what I dreamed about. I think my very, very first patient was a broken foot where he went home. We found a boot on Amazon that we could get her ordered. She didn't have any insurance at the time, so we're connecting with orthopedics to see if we can get kind of a courtesy consult. I've kept several patients out of the hospital where otherwise, if you would have called at 5 o'clock, the answer would have been just go to the hospital. But with quick and close monitoring, text messages throughout the week, dosing changes throughout the week, I kept someone who was newly diagnosed with diabetic ketoacidosis out the hospital.
Yep, so we're almost out of time. So unlike last time, I'm just going to say thank you, everyone, for listening. I hope you have a wonderful and productive week.